Hi, welcome to Community and Primary Healthcare Nursing Week. I'm Sue Doyle, I'm the Acting ACAS Manager for Grampians Region, and this is Angela Den Hollander. And Angela's working at Talbot Place, and she started her grad year in February of this year.
That's right.
So Angela, first off, why did you want to become a nurse?
Sure. Well, it's a career I can do locally. I live in a rural location, and with nursing there's always plenty of work opportunities absolutely everywhere. I'd say it's also in my blood. My mother was a nurse, my aunt is a district nurse in New Zealand, and my other aunt is a pharmacist. And I'm a curious person, and nursing is a career that you can always be learning. There's always something else to do.
What exposure have you had to community nursing?
I did some great placements during my undergraduate program. I had a month here in the Ballarat Health Services community divisions, rotating through a lot of different divisions such as HARP, GIF, ACAS, CADMS, a whole bunch there, and I also did some remote placements as well out in Tennant Creek and Alice Springs, and community nursing as well.
If you think about your career, where ideally would you like to work?
I've got my eye on some programs like HARP or CADMS or ACAS, I really like those. Also looking at community mental health as well. Next year I have a postgraduate in community mental health. I've secured a position with them, so yeah, thank you. Yes, great to explore those options. Yeah.
Great. Well, tell me about your experience in community nursing.
Yep.
It'd be interesting to hear about Tennant Creek.
Yeah, sure. So here I went through all the different divisions, which was fantastic. But say out in Tennant Creek, I was working a lot out in community. For example, I remember doing my best student nurse going to dress a foot wound from a patient with diabetes who stood in some glass and a terrible wound, and went out to his place. It's boiling hot, the floor's crawling with cockroaches. I do fastidiously set up my little sterile field and like gloves and all the rest, and then his cat walks right through the middle of my sterile field. So we start again. And also done things like doing wound dressings in parks, because you're not going to get people to come into the clinics. Yes, so it's challenging, but it's got its rewards as well. It was great.
And similar incidents here? Or?
Not so much. No. Although there are, when you're out working in people's home environments, there are a variety of things. I remember going to see somebody here, and the nurse I was with was terrified of horses. And even though it was Ballarat, this person had a horse in their front yard. Yeah. So I had to sort of run defence into the house between the other
animals. Yes. Yeah. Tell me what excites you about nursing in the community.
I like seeing the holistic picture of the patient in the community. When you get someone presenting to the ED or to acute, you're really just seeing that presentation of that person in an isolated environment. Whereas when you go out in the community, you get to see the larger picture of what's going on in their lives, what sort of support networks they might have or lack thereof. You might notice things like the kitchen's getting a little bit out of control, the house is getting really messy, or you might see the great relationship they've got with their neighbours, or the support systems like a beloved family pet. It's those sorts of, it's that larger picture you get with community nursing that really draws me. Yeah.
And have you been able to sort of see the different services coming into play?
Yeah, doing that placement with Ballarat Health Services was really good. I had, up until that point, thought that community nursing meant district nursing, and that was it. I didn't realise that there were so many different things you can call on, sort of like the complex geriatric division, for example, where you might have an intersection of a mental health issue with the conditions of ageing as well, or mental health services with other illnesses as well. So that was really useful to see all the different things that you can draw on here. Yeah.
What challenges do you see from nurses working in the community?
A lot of the time you're working solo, so I think your assessment skills need to be really, really good out in the community. Some of the situations that you're encountering can be emotionally challenging, so I think some good debriefing opportunities are needed for that sort of thing. And I think the ratios are a challenge across the board in all nursing, but I am seeing private providers coming into the community nursing space in Ballarat, and it's always my concern that anything run for profit obviously has to be about maximising that profit, and therefore it's pushed to see as many people as possible in one day, and not sure that's really giving the best quality care to people. Excuse me.
Can you think of a community nurse that has inspired you?
I'd say my aunt is my inspiration. She's been an absolute mentor to me throughout the undergraduate process. She's been a district nurse for most of her career in New Zealand, and now she's lecturing in community nursing at university over there. And she's also got onto the board of the local aged care centre so that she can be a real change driver for that industry over there as well.
And is the model for community nursing in New Zealand similar to Australia?
I think it's similar to what we were, in that it's publicly funded community district nursing model, whereas as I said, I'm seeing that moving to private providers more and more across Victoria now. So yes, I think New Zealand has that more public health focus.
And tell me a little bit more about your aunt and the inspiration that she has for you.
Yeah, I really appreciate the way she's been there for me right throughout the process. There to answer questions, she's a really stresses the importance of not rushing into the career because you are out on your own. She said to take your time and make sure you got your skills up, and had some good experiences in the acute ward to get those assessment skills really working. And I know she's really taken on board and mentored other young people as well in their early stage career, nurses in New Zealand with lecturing.
Great, thank you. And when you think about your career, what do you want your legacy to be?
Sure. Well, my guiding ethos, I think, with nursing is to keep people out of hospital. I think that's what drives me. I look at the lovely old farmers in my community. They don't want to be in hospital. They'd like their care as much as possible, wherever to be at home. I'd like to be part of that. I think I see people doing better when they move back from the big tertiary hospitals back to my local hospital, and better again when they go home. But of course they need support to do that. So I'd like to be part of that support system that looks after them. I think what really drives me too is to give people the best quality health and life in the home setting and allow them to die at home. I think that's really what everyone wants.
That's great. And just for interest's sake, with your fellow graduates, do you think community nursing is a little better viewed, a bit more trendy than it used to be?
I'd like to think so. It really helped me doing the placements in community. It really opened my eyes to all the different opportunities that there were. As I said, I'd only seen it as district nursing, and that doesn't appeal to everybody. So I think it's really important that VHS does keep offering those placements to students so that they can see all the things that are available there. It certainly raised the profile. We have someone going through a community nursing rotation in their grad year at the moment. So I think that that's the way to do it, is to keep offering students and grads the opportunity to work in community.
Yeah, that's great. Well, thank you, and good luck with your career.
Thank you.